Hello, good evening. My name is Taiwo, and I'm one of the nurse practitioner students from United States University. I'm here this evening to perform cardiovascular assessment on my patient. And good evening. My name is Taiwo. Uh, I'm going to be your nurse today. How are you?
I'm fine, how are you?
Good. What is your name?
My name is Michael.
Michael. How old are you, Michael?
I'm 18.
18 years old. Okay, good. I'm here today to perform cardiovascular assessment. What that means is I'm going to be listening to your heart sound, I'm going to be checking your pulses, and I'm going to be checking your blood pressure. Do you give consent for me to perform the assessment on you?
Yes.
Okay, awesome. And also to let you know that the video is going to be uploaded on YouTube for teaching purposes. Do you give consent to do that?
Yes.
Okay, good. So before we begin the assessment, I'm going to wash my hands, okay, and then we get started. Okay, my hands are washed, and we're going to get started with the examination. Are you comfortable?
Yes.
You have any pain at all?
No pain.
Okay, good. To do the assessment, I have some tools here with me. I have my blood pressure cuff. I have my measuring tape here. I have my little measuring tool, like a little measuring device that I'm going to be using as well to do this assessment. So first we get started with measuring of your blood pressure, and also with my tools. I have my stethoscope here to listen to your heart sounds and also monitor your blood pressure. Okay, so what I'm doing now is putting this spinometer, is a blood pressure, manual blood pressure curve in your right brachial artery, and uh, so then I put my stethoscope right by your brachial veins, and also listen to your systolic and your diastolic blood pressure. The systolic blood pressure is your top number blood pressure, and the diastolic is the bottom number. And awesome, awesome. Your blood pressure on the right side, right brachial, is 110/68, and that is good. So also I'm gonna, while I have you on your supine position, I'm gonna come to your side, your left side, to check the blood pressure again. Let me move to the left side. Okay, 110/65. All right, so I'm gonna have you sit up in a sitting position. Then I'm gonna also check your blood pressure as you sit up. The little reason for this is just to compare the numbers and see how um, that you don't have any drop or big variance in sitting and laying down blood pressure reading. Okay, awesome. 110/64. 110/64. Then let's come to that side. Then I'm going to do this side one more time. Then we're done with the blood pressure reading. All right, but so far your numbers are great and they are within normal ranges. Okay, 110/65 again. So your blood pressure within normal, and so we're done with the blood pressure reading. The next thing to do now is to check your jugular vein. Okay, so that's the veins that supplies blood to the part of from your heart to the part of your brain. And so we want to check that. We want to check for the pressure and make sure that it's within normal limits. So I'm going to position you a little bit. So I'm going to have you lay down. Okay, you're going to be in kind of a 30 to 45 degrees angle. All right. Let's do this. That's good. Then I'm going to have you turn towards your left side for me. Turn your head towards your left side. Okay, so as my patient turn, so I can see the jugular veins right here, and I can see the pulsation at the notch arc right here. So what I need to do now is to measure at a 45 degrees angle to measure the length of the pressure of the jugular vein. So normally we know that in a normal jugular vein pressure, 3 centimeters below is normal. Anything above 3 is abnormal. So the point. Okay, point of arch right here. Okay, so what I have here is 2.5 centimeter. Okay, which is normal. All right. So the next thing is to inspect, your carotid pulses. So I want to inspect the carotid pulses. I also want to palpate the carotid pulses as well. So I look to the right side. The carotid pulses right between the tracheal line and the mystoid. So I don't see any swelling upon inspection. I don't see any lumps that could indicate any mass on both sides. So then we'll palpate the right carotid pulse first. So the grade is 2 plus, which is normal. On the left side, the grade is 2 plus, which is normal. All right, good. So then the next thing is I'm going to listen, okay, which we call auscultation, of your carotid pulses. What I'm listening for is to check for any bruise, okay? So any abnormal sound. So I'm auscultating with the diaphragm of my stethoscope, and also I'm going to auscultate with the bell of my stethoscope. Okay, great. I don't hear any bruit, so which is a normal assessment for you, Michael. So what I'm gonna, the next thing to do is to look at your chest wall. Okay, I want to see your chest wall. I'm inspecting, um, making sure that I don't see to see the symmetry, how alignment they have. The right and the chest part of your wall, so which is symmetrical, which is normal. I don't see any bruise. I don't see any lesion. I don't see um, any lumps at all. And your skin color of your chest wall is moist, and uh, there is no discoloration noted this time. So what next thing I'm gonna look at is also to check pulsation um, of your apical. So apical is where we hear your heart sound most, and so check the apical. So and also um, check for the pulsation of your aorta, which I consider pulsation. Then I'm going to also auscultate, listen with my stethoscope again to listen to your heart sounds. Okay, so on both side, right, left side, and the right side, and we'll go all the way like that. Okay. Um, so let's check. So the first place I'm coming to is your second intercostal space on the right side of your heart, which is the we want to listen to your aortic sound. Okay, so aortic sound, that's where we hear most your S1 sound. S1 sound is your normal heart sound. I mean S2 sound. Okay, and also we go to the pulmonic, which is the second intercostal space. We also listen to your S2 sound as well. Okay, so so I'm coming to his second intercostal space right by the sternal border uh, for the aortic sound, which is S1 sound. Then right across to the left, second intercostal space by the sternal border for the pulmonic sound. Then on the third intercostal space is the S point, is the midway between the pulmonic sound and the tricuspid sound. Then on the fourth intercostal space is the tricuspid sound. So then I'll go to your fifth intercostal space by the mid-clavicular line to listen to your mitral valve sound. Okay, awesome. So as I was listening here, I can hear your S1 sound, which is a normal sound. S1 sound is when the mitral valve and the tricuspid valve close. So we heard your S1 sound, which is your normal out sound, your first out sound. Then as I listen to your aortic and pulmonic, is where I can hear best your S2 sound, and that is where the aortic valve and pulmonic valve when they close as well. So I don't hear any abnormal sound like S3 sound or S4 sound. Okay, I, I don't hear any abnormal S3 sound or S S4 sound. So the next thing is to auscultate your point of maximum index, which is PMI. So right here, by the right here. But before I do that, let me um, just what I'm doing is touching it or palpating it. I want to feel it first, okay, with your point of maximum index or the apex of the sound. So it's pulsating. The grade is 2 plus, and I'm going to auscultate it again. Okay, yeah. So, and then the next thing I'm going to auscultate is your aortic, your abdomen. I want to check for your, aorta. I want to check for your renal arteries, making sure that the bloods are flowing to the lower part of your organs. Okay, and also as we're doing that, I want to check for any abnormal sounds like bruise. Okay, so we're gonna do the aorta first. Then the next one I'm gonna do is your renal on both sides. Okay, I'm gonna give you a little privacy here so I can do your iliac. Okay, good. So I don't hear any bruit, I don't hear any leaves or lifts. They are all normal sign that the blood is flowing through your arteries into your kidney and also into your lower part organs. So the next thing I'm going to do is with the bell of my stethoscope, I'm going to check your femoral um, femoral pulse. I'm going to auscultate that, and also I'm going to use the diaphragm as well. Okay, so I'm going to have you just with a little privacy. Can you move this down a little bit for me so I can have much access? Okay, first I'm going with the uh, bell of the diaphragm of my stethoscope. Okay, good. Then let's do the other side. Okay, so I don't hear any bruit, I don't hear any leaves or any lifts. So it's a normal sign that the blood is flowing through your femoral arteries. Okay, so the next thing we're going to do now is to check, I'm going to have you check your upper part of your hands and also check your lower part of your hands. Okay, so I'm going to check for that. So I'm going to have you stretch forth your hands for me. Stretch forth your hands, stretch them out. Okay, so what I'm looking for is to inspect, can you lift it up? So I want to see, the symmetrical of your hand, the color of your skin, which I don't see any discoloration, I don't see any rash, I don't see any lesion. And the next thing also is to check for your nails, okay? Check for any clubbing, check for any tears. I don't see any clubbing. Clubbing is like when your nails are forming more harder and rigid. I don't see any of that. So they all look normal on both sides. Okay. I don't see. Can you lift it up a little bit more? I don't see any tremors from his hand. Then I want to check also for your capillary refills. While I'm here, capillary refills. Okay, is less than 2 seconds, which is normal. Okay. All right. So the capillary fill is less than 2 seconds, which is normal. So while we are working our way down, I'm going to check your radial pulse. Your radial pulse is the pulse right there by your wrist. Okay. Okay, the grade of his radial pulse is 2 plus, which is normal. And also I'm checking your brachial pulse. The brachial pulse is also 2 plus, which is normal. Then checking on the left side, the radial pulse, 2 plus. The left side radial pulse, 2 plus. Brachial pulse is 2 plus on the left side. And then the next thing I'm going to do right now, let me move this my tool away a little bit, is to check the lower part of your legs, the lower part extremities. So I'm going to move this, okay, to give you privacy. Can I have you roll up your... All right. Thank you so much for your assistance and your cooperation, Michael. I would really appreciate you for that.
No problem.
So I'm looking at, first I'm inspecting your feet. I'm inspecting, want to check for any skin discoloration. I want to check for any swelling, which we call edema. I want to check for any cyanosis, which we call bluish discoloration of the feet. And as also I'm checking for any bumps. I'm checking for any wounds, either anteriorly or posteriorly. I don't see any wound. I don't see any lesion. I don't see any bluish discoloration. There is no edema. The skin is intact, and the skin color is pink, which is normal for the ethnicity of my patient. So the next thing is to feel your posterior tibial popliteal, popliteal pulse. Let's do the popliteal pulse first. The popliteal pulse is the one right below your knee. So let's do the right side first. Okay, I'm gonna have you bend your knee a little bit. Okay. The popliteal pulse is 2 plus, which is normal. On the left side, 2 plus, normal. And then also I'm going to check the posterior tibia. Two plus is normal. 2 plus normal with the posterior tibia on the left side. Then I'm checking the pulse with this is called the dorsal pedis. So dorsal pedis 2 plus, which is normal, 2 plus, which is normal. Okay, so down here there's, so you have a, there's no lesion, and everything looks normal on that side. So the other area we look at is you know, you have any question or any concern?
No.
Okay, no question for me?
No.
Okay, so I think the assessment has been very well, wonderful. I don't see any abnormalities at all. All your heart sounds, your pulses, they are all great. And I want to thank you for your time, and I hope I will see you again next time.
Thank you.
Okay, bye bye.